Good morning, everyone. We'll just give everyone a minute or two to just join. We've had about 130 people register and we've got about 50 online so far. So I'll just be back at another 2 minutes and then we'll get going. Thank you. While we wait for everyone, on your top right, you'll see a QR code. You can scan that with your phone and you can ask questions. That'll pop up on the bottom right here. I'll try to address as many of them as I can, or maybe take them on notice throughout the presentation. Thank you. We'll start at 5 past the hour. Thank you. It's minimized. Okay, good morning, everyone, wherever you may be around the country. My name is Fahim Khondaker. I'm a partner here at BDO. I lead our data analytics and insights practice. Before I kick off, I'd like to kick off by acknowledging the traditional owners of the land upon which we've gathered here today. I know that we've got people from all over the country today, so I'd like to pay my respects to the elders, past, present, and emerging of those communities. I'd also like to note that the Royal Commission recommendations significantly focus on the Aboriginal and Torres Strait Islander community on this occasion as well, and it's a great progress in that aspect as well. As for today, obviously being a webinar, we'd like to try and make it as interactive as possible. I'd like to apologise at the forefront of any technical glitches that we may have, so please bear with me as I sort through Windows. I'll let you know if I have any issues, but it should all work. What you'll see on your screen, hopefully, is on the top right a QR code and then on bottom right a question panel. If you use your mobile phone and just scan that QR code, you should be able to type questions into your mobile phone. That'll pop up here. So throughout the presentation, please feel free to add questions on there. We'll try to address as many of them as we can live during the show. If not, we'll take them on notice and come back to you. We've got about 1 hour or 55 minutes now. I'll go through the presentation in about 45 minutes or so and probably stay back for about 10 minutes or so if anyone wants to ask any questions. The slides will be circulated to you following the session, and the session will be recorded as well. So with that, let's get going. So our involvement with the Royal Commission so far, many of you may be aware that we were engaged by the Royal Commission to report on the viability and the profitability of the sector as a whole. So I authored that report on behalf of BDO, and basically the work that we did was to analyze almost 3,000 financial statements to essentially come to a conclusion on whether the sector is viable or not. Our report is publicly available. It's on the Royal Commission's website, and I think it's research paper 12. Following that, we were asked to present at the hearing. So we had to present at the Royal Commission hearing on the 14th of September and basically talk to our report at that. Towards the end of last year, and I see many of you did join these sessions. Last year, we had a roundtable in November and a webinar in December just to talk about what's coming and talk about the proposed recommendations. Just 2 days ago on Tuesday morning, we had another roundtable, and today we are here at our webinar to discuss the recommendations, the final recommendations. As you all know, the final recommendations came out on Monday afternoon, which basically means none of us had a lot of time to analyze them. So hopefully today is just a starting point to help you get familiar with some of the recommendations, and hopefully it helps you in a practical way where you can start planning what that means for your organization specifically, and hopefully you get something of value out of it in terms of things that you can action. That's our objective. At the roundtable last year, we collaborated with aged care providers, and we actually co-designed a number of perspectives to view the recommendations from that aged care providers themselves considered to be practical. So today we'll take you through some of that as well. We have built an interactive tool, an interactive software dashboard to explore the recommendations through. So that's exactly what we'll be doing today. Okay, in terms of a proposed way forward, we thought that there's probably about 6 things as an approved provider that may be relevant to you, and today we'll try to cover off the first 2. So starting with understanding the recommendations as best as we can, trying to assess the current state of our organizations to determine how much those recommendations may impact us. As you know, there's a huge volume of information. I think I was talking to some of the people from the peak bodies yesterday afternoon, and they were saying that they counted about 3,000 pages of stuff in total. The recommendations are about 105 pages long. So at some point, you're going to have to figure out a way to prioritize what initiatives you want to respond to first, develop some options, evaluate them, and then come up with a plan to execute those options, because I think a lot of action needs to come out of this if those recommendations get adopted by the federal government. So with that, we're going to spend a bit of time today to try and understand the recommendations, and then at the back end, we're going to talk you through some of the ways that we've developed where you can help, you can use to assess yourself and your own organizations in light of the recommendations. So I'll put this up straight up. So the first one was the recommendations have changed from the proposed ones that were issued in October last year to the final ones. So they've moved from 124 proposed ones to 148. A lot of the differences are categories being split or the commissioners disagreeing with one another, and we'll talk to more of that a bit later. Also worth noting, and I love seeing what changes, so 16 proposed recommendations were removed and 33 new ones were added. So that's quite interesting to note. The Royal Commission were pretty good in putting some categories and categorizing the recommendations for us, which is really handy. What we did then is we kind of recategorized them based on practical implementation from an aged care provider's perspective. And we did that working with CEOs and board members and executives from aged care providers themselves. So our categorizations were as follows. So there were 6 of them. So we wanted to know which recommendations relate to workforce, which ones relate to care, how many relate to governance, any other operational matters, how many will impact our structure, and then how many will impact our funding and finances. On top of that, the other thing we started doing was we wanted to know when each of the recommendations will come into effect. A lot of the recommendations have dates specified. I think there's only 22 that don't have a date attached to it. So we wanted to put that on a timeline. We also wanted to have a look at communications, which I'll come back to in a second. The other two areas that we considered were new entities and regulations. So whether any new entities were being set up or any new regulations were being set up, we wanted to understand them very quickly. And then whether the recommendations were direct or indirect. And that means some of the recommendations go directly to approved providers, whereas others go to another entity or a government department who've been instructed to do something which will then impact approved providers in future. And the final thing we looked at, and we've partnered with our friends at Roland Group, which is a communications and PR company. They basically went through all of the recommendations for us and with us, and basically worked on identifying which ones will have significant communications challenges, both internally to your staff and your leadership group and your people in your care, or externally to the market, to prospective customers, and basically just for your marketing needs. So we've basically gone through all 148 recommendations and grouped them and marked them up to analyze and understand. So the first one I'll just show you is this one here. This is how it plays out if you were to look at the numbers in terms of how many recommendations touch each of those areas. So significant impact on governance, as you can see, a big one on finance areas. Workforce is significant as well, as is quality of care, but that's how it kind of breaks up. Structure looks small, however, there's one in there, one of the recommendations, which will probably impact a lot of providers in terms of how they structure their group of entities. And that recommendation is the one around capital adequacy and liquidity requirements. Depending on which element they would like the capital adequacy and liquidity requirements to apply, whether it's at the approved provider level or at the group level, it could have significant implications for how the groups of entities are structured. If you're not using a group of entities, it probably won't impact you as much. So that's first one. I will jump into an interactive tool in a second where we will go through each of the themes under each of these categories. The next thing to note is the timeline. So there's the timeline in front of you. I'm hoping everyone can see that well. As you can see, there's some markers on the 30 June or July, 1st of July sort of markers. So there's one in 2022, one in 2021, there's a spike in 23, and then a spike in 24. There's a couple of things that come in at the end of this calendar year, so 1st of January or around December this year, and then there's some scattered across. If you're wondering what that first one is that's already immediately into effect, that is the viability supplement that was implemented in March 2020, I think it was, and the recommendation is that continues. There are 22 recommendations that don't have a date specified. I'll remind everyone who's joined a bit late, there's a QR code on your top right. If you use your mobile phone and scan that, it'll take you to the question and answer polling website, and you can type in your questions in there and it'll pop up here and I'll try to address them as well. So timeline taken care of. Next one was the regulatory changes and the new entities. This was obviously a significant difference between the two commissioners. I'm hoping everyone's somewhat familiar with it. There's been a lot of media coverage around the fact that the commissioners had submitted independent recommendations as well as joint recommendations. The biggest fundamental difference is in this one area, which is basically an independent commission model, which Commissioner Pagone put forward, and a government leadership model, which Commissioner Briggs put forward. And basically, the gist of it is one suggests an independent entity that manages aged care and a lot of elements of aged care going forward, whereas Commissioner Briggs argued that the Australian taxpayer would probably ultimately expect that the government would have control and there would be a minister who'd be in charge of whatever that entity is. So she's gone down the government leadership approach. I will note that council assisting the commissioners, the lawyers who submitted the submissions to the commissioners for consideration, went with the independent commission model. So Commissioner Briggs basically came up with an approach that is different to what the submission was to her. And she's gone to painstaking detail, even in the executive summary, to explain the differences and what her logic is for proposing the one or the other. So there are essentially now two options available to the government to consider. And what that means is there's 4 roles that need to be covered. Under Commissioner Pagone's model, there's 1 new entity or 2 new entities that will take care of those 4 roles. Whereas Commissioner Briggs has suggested that we repurpose whatever exists. So the Department of Health, she recommends that it becomes Department of Health and Aged Care. Similarly, the pricing authority, the authority that's been recommended to determine the cost of aged care and appropriate funding and pricing mechanisms. Commissioner Pagone argued that aged care is very specific, so the independent hospital pricing authority won't have the skills to do that. It needs its own entity. Commissioner Briggs, on the other hand, argued that we can repurpose them. The other really big element of the new entities and new legislation is that aged care in Australia is actually not a right at the moment. So they're recommending a new Aged Care Act, which basically enshrines our right to aged care as a right. So we have the right to healthcare through Medicare, for example. We have the right to education, so our kids can go to school for free. We technically don't have the right, or not technically, we don't have the right to aged care. And this legislation basically brings that into, enshrines that into law. And there's a major significant shift in the focus of that new Aged Care Act. And that is basically this red line here that's on your screen, to put older people first, and it should be equitable, effective, ambitious, accountable, and sustainable. So basically pushing for a customer-driven approach and basically enshrining that into law, that you do have to listen to what your customers want as the main one. Now, in a typical business, you do that anyway. They're just enshrining that as an act of parliament effectively. That's probably all I need to say about the legislation. Oh, I will note that there is a recommendation to the Act in relation to remuneration. So when we talk about workforce a bit later, I'll talk to you about how there are some recommendations which talk about paying staff more, and there'll be some recommendations to the Fair Work Act in that context as well as they did one around unpaid carers leave for all employees of Australia. Transportation as well in the context of aged care is a recommendation as well. I mentioned earlier that some recommendations are directly addressed at approved providers, so there's 65 of those ones, and then there's 83 that are indirectly going to impact approved providers. So they basically go to either the government or another entity to look at. What that means is, from a timeline perspective, those 83 could take longer to implement once those organisations and entities have had a chance to deliberate and action whatever those recommendations are. And in many cases, the recommendation is an instruction to do some analysis. So we don't really know how long that analysis will take. So there's some time you have in place for that to come into effect. I mentioned earlier that the commissioners differed on recommendations. So there was 40 that they differed on. Commissioner Pagone had 7 independent ones himself in terms of recommendations. Commissioner Briggs suggested 18, and then there were 15 where they differed on certain paragraphs of the recommendation rather than the whole recommendation. So they agreed on the recommendation, but just differed on the sub-recommendations within those recommendations. So we obviously were very interested in what those differences were. The fundamental one, as I covered, with the entities. And then there's a slight nuance around the funding in terms of, or not slight, there's quite a significant nuance around the funding in terms of how the additional funding is to be calculated and determined. and the mechanisms are recommended as well. So there's a fairly significant difference in those two areas. There's a question that's just come through about how many of the recommendations do you think the government will adopt? How will the government deal with the differences between the two commissioners? The government in Scott Morrison's press conference did not suggest any number firstly on the one around how many they will adopt. He basically said we've got a lot to deliberate on. There's 8 volumes of information to consume and assess. You would think, given COVID in particular and the attention, the public's attention on aged care, you would think that there would be a significant level of adoption on a lot of things. Obviously, the big one is going to be funded, and there'll be some discussions on that. I think I saw an article on the Australian Financial Review a day later, where Scott Morrison did say that he would consider raising the taxes if he got support and it was bipartisan. He wouldn't consider it otherwise, and he did reference that his government did propose a 0.5% increase to the Medicare levy for the NDIS, which he argued that the opposition didn't support in the article. I'm not across the full detail of it, but that's what the article said. So that was on yesterday's Australian Fin Review article. So he is considering, I think the headline was Scott Morrison mulls over tax increase to fund aged care. So that is being considered. The second question about how will the government deal with differences between the two commissioners, I've got a feeling they will see both as options, and I'm a bit disappointed, I guess, that they're being portrayed as differences rather than options. It would be great. It would have been great if the narrative was a little bit more around here's 2 options to consider, as opposed to we differ on each other, because the word difference kind of assumes one completely disagrees with the other. So that would be an interesting one to see how that will work. There are a couple of other questions that are coming up that I will address in the interactive display as well. Just closing off on how the government will deal with the differences. My suggestion is they'll have their own form of evaluating the impact. The Royal Commission doesn't go fully into detail into the link between the economic implications. There was a fairly big piece of work done by the Productivity Commission a few years ago as well. I'm guessing the government will take all of that into consideration and evaluate each recommendation on its merits from their perspective, and then implement one or the other or none, depending on how they do it. Given the political landscape at the moment, I would imagine there'd have to be a fairly detailed explanation as to which way they are going. And obviously from an industry perspective, it's really important that we have some direction so that the industry itself can position and do the planning, the long-term planning accordingly. So this is definitely going to be something. This is definitely something that's going to take a lot of attention over the next few months and years. That really does take us nicely into the interactive demo, and I'll jump into that with another screen, and hopefully it'll just neatly take over where the PowerPoint was. Yep, there you go. So the way to read this demo is on the top left, we've got the breakdown of the categories that I showed you in a PowerPoint format. There were 33 for workforce, 56 for governance, 50 recommendations that impacted finance. On the bottom left is that timeline, so I can expand that out and I can see where the timeline is. And for example, if I wanted to see which of these 31 recommendations come into effect in July next year, I can click on those 31. I can expand this out, and these are the recommendations that will come into effect in July next year. We're looking at ways to make this available to people to work with. I'm very happy for you to reach out to us, and we can work with you and explore them with you in your own context. The other thing we did was we looked at the direct and indirect ones, and then the communication. So just a simple green, yellow, and red, being if you're an average, if we assume that you're an average aged care provider, we think there's about 41 recommendations that you'll have a moderate level of difficulty communicating internally. There's 21 that we identified, or not we, Roland Group helped us together with Roland Group, identify that they may pose significant challenges. So if I can click on that, so we're going to link that through as well in terms of identifying which 21 those are, and we can talk to that as well. What I'd like to do is spend about 15 minutes now going through each of these categories and just talking to you about the themes that have come out of each one. So I'll start with workforce, because that's one that was top of mind to most of our physical audience, even on Tuesday. So starting here initially on the left, there's 33 workforce recommendations, and of those 33, they overlap across these areas as well. So as you'd expect, workforce is related to care, workforce is related to governance, a few that'll impact your operations, and a few that'll have financial impact. What's probably more beneficial at this point in time is understanding what are the themes that are coming out of those 33. And these are the themes. So there's 6 that talk about additional of specialist staff. There's a significant focus on education and training and professional development. There's 2 that cover remuneration. There's 4 that cover roles and responsibilities. And then there's 7 that talk about workforce planning and going forward with the workforce planning. So if I were to click on that, if I click on the 14 that talk about recommendations on education and training of staff, I can narrow those down and I can see which recommendations, the number and the recommendation itself. We have imported all of the recommendations into the dashboard as well. So if anyone wanted to read the 3 or 4 pages that go with that particular recommendation, that's in the tool as well. So we have started using this to analyze the information. And the reason we did it this way is because we're trying to get to you as quickly as we could to give you some preliminary ideas in terms of how to read through, consume such a large volume of information. I was talking to one of the groups that in one of the larger peak bodies, industry peak bodies for the HK industry, and I was talking to the team that's been tasked with reviewing the recommendations. And we've all agreed that there's going to be a small little community forming of recommendation readers, and we're all going to get really close to one another and get to love each other over the next few weeks, I think, because there's a lot to go through, and it's taking up a lot of our time, obviously. So hopefully this is one step in the right direction in making that a bit of an easier process to get on top of from a planning perspective, either at the executive level or at the board level or even below, and it pinpoints areas to focus on from your particular organization. And I'll note that again in the sense that while there are 33 workforce recommendations, the workforce recommendations will impact different organizations differently depending on how you operate your workforce right now and the status and the maturity of your workforce management and your workforce planning. So for some recommendations, they may not impact you at all, but they may impact other competitors or other industry providers quite significantly. So that's worth noting as well. We'll do another one on care and go through the themes on care, and I'll just open this one up and expand it for everyone. So there's 25 recommendations talking about specialist services, which is quite significant. There's a big focus on quality of care, as you'd expect. It's in the name of the Royal Commission as well. They talk about quality and safety. The duty of care is quite significant as well. The support for informal caregivers was interesting. Basically, they're talking about making more information transparent. It is something that is directed at the Australian government rather than individual providers, but essentially the idea is that if I'm an informal carer, I should have access to more information about the aged care industry and possibly even go down the path of how the operations of that industry work and the care and the level of care and all of that sort of stuff as well. So there's a significant body of data sharing type arrangements that are being recommended. In addition to that, there's some accommodation improvement recommendations as well in terms of the facilities. This all goes back to that principle of the new act that they're going on about putting the people first and the first, care recipient first, and the needs of the care recipient, and basically meeting their needs and being driven by them as well to an extent. I'll just, while I had that selected, you can see that recommendation 14, it's a pretty all-encompassing recommendation about creating a general duty to provide high quality and safe care. We're going to go down the path of what does recommend, how do you measure that quality and safety, and what are you going to get against? And that is a debate that many people are having at the moment. To go down to governance next, there's lots of them, 56 issues, recommendations relating to governance. The big one is new reporting requirements, and 17 on responsibility and accountability. There's 7 on penalties as well, and penalties may form different things. They talk about sanctions or giving a government entity some form of authority to force an approved provider to report on certain things or to do something like that. So we've cast those as penalties in that sense. They may not strictly be a penalty; they may just be a reporting obligation. Some of those are kind of we can debate about it, but at least it's a starting point. There's a big focus on minimum standards. Quite a significant one actually, on enshrining a review of the quality standards. There's a review on the appropriateness on the level of education that's being offered both at the RTO level as well as at the university level, and so reviewing those standards and of qualification, setting some standards of care and reviewing those standards of care to benchmark against and to measure against is a pretty significant body of recommendations coming through. And then there is some assessment recommendations. Entry from memory, this was entry of care recipients. I'll have a quick look at just pulling them up, which those were. So increase access to medication management reviews, approval of providers. Okay, so there's one on there. Accreditation of care services, and graded assessments and performance ratings. So all about entry into the industry as well. So there'll be some standards and governance around that as well as part of the recommendations as well. So yeah, as you can see, lots to go through, many parts of your business and organization will be impacted by these recommendations. It's just a case of firstly trying to understand them and then loosely planning for them and coming up with a bit of a prioritization framework, because you won't be able to do all of them at once. So there's a significant body of work that teams will have to start doing very soon. Would probably recommend not waiting for that planning phase, not waiting for the government to determine which recommendations they'll adopt and which ones they won't. You can still start preparing at this category level, because it's really going to be really important that you've optimized everything you currently have and it's running as well as it can, so that when the new change comes, depending on which ones the government implements and which of the recommendations they adopt, you are best placed to react accordingly. What you don't want to be doing is fixing stuff that should be fixed now at the same time as new recommendations, because that'll make things even harder. So there's a fair bit of planning that needs to happen very soon. This page is quite interactive. So this timeline is now only the governance timeline. When I select governance over here, you can see that a lot of the governance recommendations kick in pretty quickly. So regulation of restraints, volunteer and visitor scheme and all of that. There's quite a few that are kicking in very, very early. So that's worth having a note of as well. And then there's we've got a bit of leeway till towards the end of the year. A few more come into effect, and then a big chunk of them come in next year as well. So that's worth preparing for. I'll skip I'll just quickly show you what they are. The other operational impacts, so changes to funding will have operational impact for you, changes to roles and responsibilities, improvements to existing services is a category that's kind of formed, or a theme that comes through, which is kind of what I was talking about a bit earlier as well. There's a significant push for new technology, and I think that's a key one. I don't know if it's safe to assume that there'll be the funding will get to the level where the current form of performance will be fully funded on a larger scale. I've got a feeling that there will be a significant push towards finding efficiency dividends or requesting approved providers to essentially find efficiencies to fund X% of the total funding required. I think technology will play a big role in that in terms of automating processes and improving process flows and things like that. Got about 23 minutes, so I'll keep moving along. Apologies if this feels a little bit rushed. It is going to be recorded, so you'll be able to pause and listen to it again. And obviously, please feel free to reach out to me afterwards, and we can talk through them in more detail. There's only 2 more categories. Structural one is the easy one, as I suggested. I don't even need to expand it. There's some implications of legislative amendments. The big one is this one, the liquidity and capital adequacy one. It's probably going to disproportionately impact the for-profit providers from the analysis that we did for the Royal Commission a few months ago. It's the for-profit providers will probably be impacted the most, but it'll actually impact anyone who uses a group of entities, not necessarily only for-profit entities. So if money is moving around in your group of entities from the provider entity to the parent entity, or some organizations set up like a service entity, a capital investment entity, and things like that. So if your money is moving between those entities, that this liquidity and capital adequacy ratio requirement may have significant implications for you. And then there's the other big one around out of refundable accommodation deposits. So the council, assisting in their final submission to the council, to the commissioners, did talk about the long-term goal being to do away with RADs, given how complex and opaque it is. I don't know the full detail off the top of my head, but my read of it initially last night was that it's not saying that the capital required to then build the facility, that onus won't go to the approved provider. I think what they're talking about is you effectively get a loan from a government entity of sort. So because the government's currently underwriting the RAD, and it would be, given the opaqueness of that relationship and the complexity of that relationship, rather than underwrite it, they may be talking about the government just funds that RAD component as a loan, and then has a direct relationship with the care recipient in relation to what the RAD would have been in the first instance. So it's probably coming more from a transparency angle and a simplicity angle, rather than a where's the source of capital, like what approved providers will have to fund that capital. I don't think it's quite that. But initially, at first read of the headline of phasing out of refundable accommodation deposits, a lot of people were like, whoa, that's a huge, we can't sustain that model, was a lot of the feedback we received from many providers on Tuesday morning at the webinar. The lucky last, the finance one. Again, there's 50 finance ones. A lot relate to workforce, a lot relate to care, a few around governance, a few around operations, and obviously we were talking about the two big ones in the structure. I'll take you through the themes of the finance ones. There's a push for funding for additional services. There's a really targeted section of the recommendations around specific community segments, and I mentioned this in my acknowledgement of country at the beginning of this presentation. There's a huge focus on the Aboriginal and Torres Strait Islander community, and then there's also particular segments of people with certain disabilities as well being called out, and special funding / services being required for them is a key part. The funding implications of new entities or regulations is quite interesting, obviously, because there's a ton of new regulations being discussed or what you call new entities being directed to set up, depending on Commissioner Pagone versus Commissioner Briggs. But either way, there'll be entities that have been instructed to look at certain elements that impact funding or expenses, either way. There's new obligations that will incur expenses in our view. There's 4 of those that we've identified, and then staff remunerations. There's 3 recommendations on staff remunerations. If you've got a unionized workforce, I imagine this will flow onto your EB agreements and things like that as well. So I imagine that will be something to get across as well. I'll go back to the all section again, just to have a bit of a play. So first and foremost, I'll talk a little bit about the comms area. As you can see, there's quite a few recommendations that are in the red that we believe that will have significant communications challenges, both internally and externally. And it's really, really important, given the narrative around aged care at the moment in the media, given the political narrative around it as well. It's really important to have a very clear communications plan for your organization and how you're going to communicate what are the actions you're doing, both to your staff who are on the coalface dealing with care recipients on the ground and their families, and then communication to their families and the care recipients themselves, communication to the general public as well. I think that's going to be quite important for the sector as a whole, and then obviously communications to prospective customers, or prospective care recipients, to attract more people back to your organization as well. We've got about 73 others to reclassify. That's why they're showing up in the. We'll get that done very soon as well. Okay, that probably takes me to the last 15 minutes or so. I do have a walkthrough of how you can, in light of this context, how you can sort of assess your organization in terms of identifying areas that are most likely to be impacted from these recommendations. I was talking to another provider in the sector, and there was a lady there who had a really great idea about flipping it into a capability requirement rather than an impact requirement. So looking at it more as a positive thing of, okay, that's going to be the recommendation, that's the potential implication, the capabilities we need to address that is the next logical step. So that's probably one way to look at it, and I'll do a very quick 5-minute overview of that. But just before I do want to address this one particular question that's here. In your opinion, the potential rollout of the different recommendations, how much is governance first versus financial, as is financially strapped? Interesting. When we presented at the hearing, as well as in our report, in the build up to our presentation to the hearing, we did talk a lot about the operational / governance / regulatory burden that these recommendations will basically put on approved providers. And I think there's a particular recommendation that actually talks about determining the appropriate level of funding for those requirements, or those additional requirements. So it is covered in a sentence or two, in a recommendation or two. I'm not of the full detail that goes on to, but at least it has been acknowledged that we're talking about additional reporting of the things. So that'll be an interesting governance first versus financial first. Well, easiest way to do that is to probably look up the financial ones again. So there's 50 finance related recommendations that we think 9 of those are related to due to governance. If I go the other way, there's 56 governance related, and we think there's 9 that correspond to the same one. 9 of these that will directly have a finance impact in some way, shape, or form. I guess you could argue, however, that if it has a workforce impact, it'll have a finance impact in another way. So that's worth just having an initial cursory glance without going into the full detail. Okay, So that takes me, I've got about 14 minutes. So I'm going to minimize this and hopefully my slides are still on your screen. What we're building is an assessment tool that we are, what we are doing is we're building an assessment tool to help providers assess which areas will impact them. So what we're going to do is, best to just show you. So assessment of workforce, we think there's 4 areas to look at from an assessment perspective. The attraction and retention of staff, the capacity and capability of your current staff, the coordination inside your organization about rostering and coordination and things like that, and then what you do on the training and development side. And what we've done is we've kind of come up with like a positive statement that, for example, we attract appropriate skills. We've got policies and processes in place that attraction and retention is not a problem. And basically what we've done is we've just said, you either disagree, neither agree or agree. And depending on how many greens or reds you have, you could have a bit of a initial early assessment of those workforce recommendations from the Royal Commission, how likely they are to impact your organization, whether significant, moderate, or minimal. And as I said, the recommendations will impact different organizations very differently. On the care side, we think there's 3 broad categories to look at: the standards and how you comply with standards and what standards you set at your organization, the processes you have in relation to delivery of care, and your staff, again, so kind of related to the workforce recommendations. Same thing again, just agreeing, disagreeing, and then depending on your answers here, you can have a bit of a look at your impact of care. I think that's a typo there, sorry, that should say potential care impact. Governance, same thing, basically looking at the roles and responsibilities in your organizations and how clear they are and how well documented they are, your views on risk and your risk management, what you have in place in relation to that, having a very good risk management framework documented and that's well understood and basically lived every day, and then your reporting, your regulatory reporting, how good your processes are around that. And again, depending on how you are currently on that area, the governance requirements will either have a significant, moderate, or minimal impact. And this is kind of what I was saying earlier. It's really important to get this sort of thing in order right now, so that when the recommendations do come in, they have a lesser impact on you and you can get ahead of the game. Those of you who are in a life cycle where you're looking at growth and acquisition of other entities, the organizations that will be better prepared when the recommendations come into effect will probably have more opportunities in market as well. So that's probably another incentive to get that all sorted. When I send the slides through, each section will have these graphs filled out for you, so you can have a look at them. Assessment of operations. So this is the other one. So just getting across your current operational activities. I really like this one. I find that this is probably the easiest way to do getting an overview of operations. Is to follow your customer journey. So right from the point where I may be considering using an aged care service for my parents, so I'm the initial customer, from that point to me actually arriving at your doorstep, you taking care of my parents, and then the service you offer my parents, and then the interaction you have with me on a day-to-day basis, right through till their departure from your service. Every touch point and every element of touch in that point, so finance, interactions, service, information you give me, services you offer my parents, all that sort of stuff, every element of those operational matters, making sure that you've actually got that journey mapped out and you are aware which parts of the journey your organization is very good at and which parts of the journey your organization could improve at. I think that's a really nice, safe way to take care of it. So, and it could go all the way through to general services. As I said, I've highlighted a few things here: onboarding, caring, exit and departure, and general services. Resources that you rely upon to do that. So we mentioned earlier that there is a recommendation on new technologies and processes. I think that's going to be even more imperative going forward, just using technology to ease the burden, both from a compliance and risk management perspective, but also from an efficiency perspective. You simply can't, there's a lot of things that just need to be done quicker and more efficiently is the expectation, because the customer expectations have gone up in the sense of aged care. So to be able to deliver that, you'll have to get across very good processes and then technologies, understanding your technology options that may help you expedite that. And then dependencies is the final one there as well. So dependencies are basically trying to highlight to you, and hopefully I've done that throughout the day today, that nothing is in silos. So if there's a workforce recommendation, naturally there'll be some implication of that in your governance area or in your reporting area or finance area. So being across which part of your business or your organization is being impacted is really, really important. I always give the pest control analogy. If you get pest control at your house, what usually happens is the pests just move over to your neighbor's house. You don't want that situation happening inside your own organization. So being across how to solve it holistically rather than through one division at a time is going to be really important as well. Structurally, we talked about this a little bit. So understanding your corporate structure and whether you utilize group structures or not is really important. Making sure your inter-entity reporting and all the documentation is in place appropriately. So all the guarantees and loan documents and all that sort of stuff is done appropriately is really going to be important, and it's reported appropriately. And even knowing what happens to if there's we have seen instances where approved providers use entities in the group doing other businesses other than just aged care as well. We're perfectly fine in terms of what's allowed, so nothing untoward there, but then just keeping trace of the dollars and being able to report on all of that is going to be really important. Getting across that is really, really important. And then if you're using groups of entities, just making sure that you've got adequate independence and things like that. So there's no conflicts of interest and things like that. Just making sure you're managing all of that appropriately, because I think there's going to be a lot of scrutiny in the flow of funds in the sector. For those of you who don't know our entire analysis for the Royal Commission, I do recommend you have a look at research paper 12 or even listen to our presentation at the hearing. Those links through with this slide deck. We did a lot of analysis at the expense level for every single organization, just to trace where the money is going through the group of entities and things like that. And there was, I think, about $7 billion worth of related party receivables on the balance sheet of aged care providers that we then couldn't trace one step further because we don't have granularity and oversight over those $7 billion. So that sort of thing is going to be in the eye of the regulators going forward, I think, in some way, shape or form, whether it'll just be a reporting obligation or, as they talked about in that liquidity ratio recommendation, whether they will actually prohibit or a lot of that money going out of the approved provider entity or not is probably up for debate. But all of that aside, it's really important that you, as an organization, have oversight over all your funds and make sure that you know where all that's going. Finance side, finance is pretty simple. Look at all the revenue drivers, look at cost drivers. It's simple in this slide. It's probably the hardest thing to do in practice. And just working out, you understand fully all your cost drivers and revenue drivers, and you're optimizing that. I remember looking at the analysis, on the whole, we found that there was a group of aged care providers that on average was basically charging $10,000 per annum per patient less than other providers on those ACB revenue requests and things like that. So understanding all your billing options and making sure you're maximizing that to your risk appetite, in accordance with your risk appetite, obviously, and in accordance with your service is going to be quite important. And then on the cost side, flip side of it, understanding all your cost drivers and understanding which costs add value and which costs you can figure out a way to find efficiencies on. I'm fast running out of time. I've got about 4 minutes. And interdependencies, again, just highlighting a change within one part of the organization, making sure that you understand it across every other part of the organization. So again, the idea is to basically assess where we are on each of those categories, and then determine whether the implications of those funding and finance recommendations will impact us significantly, moderately, or have a minimal impact on us. Is probably a good starting point, and that's kind of where we are looking to go. Communications themes, I'll circulate these, but our friends at Roland went through the recommendations and found these common themes that are coming out that you'll have to start communicating strategically to various stakeholders, internal and external. And similarly, they've come up with a bit of a checklist on how to assess which part, what you should have as good communications practice in your organization. Roland did highlight that probably the starting point is your internal at your coalface. It's really, really important that the leadership get the message out through the organization really, really quickly, and support that they need to communicate is really important. I'm going to wrap up here with a special thank you to my team that actually helped with this. I get to do the fun bit and present in front of you, but there's actually a big group of people that sit underneath it to analyze these photos. Are from Monday night. I think this one was 7 p.m. It was around midnight, where we were trying to analyze all the differences between the two commissioners. You can see little bits of highlight in there. Those are all that we're reading. I'd like to make a mention of my colleague Alex Taylor, who did all of the data analytics work that you saw today, as well as the analytics work that we worked on for the Royal Commission investigation as well. And then my other colleagues have all contributed in some way, shape or form today as well. So I'd just like to acknowledge them as a thank you. Finally, we get to next steps. So you will get a version of this slide deck today, later today, with a bit of a message with some links that you can read for your information. I think that the recording of our first webinar is also publicly available. So we'll package all that up together. We're spending a little bit of time trying to work out how best to engage everyone. So one will be, we're trying to figure out a way to get that interactive dashboard that's accessible to everyone in some way, shape or form. If not, obviously, please reach out to me. And then we're considering maybe a LinkedIn discussion group. We will do quarterly events for the next 2 years or so. That's the plan. So the next one will be towards June. So please keep an eye out. If you've attended this event, I think your name just goes on the subscription list. So please do that. And then I'd like to work with individual organizations to do a deep dive into what we've touched on and help organizations tackle what's coming ahead. There's a lot coming. It's the largest change in about 24 years. So really exciting opportunities for everyone. To essentially look at how best we can take care of such a important section of our community and our society, the elderly people in our care. It's phenomenal, the service and the type of service and the purpose behind what you all do. So I hope that this is a moment of positivity, that we approach it with excitement and opportunities to improve. On that note, it's 10 o'clock on the dot in Queensland, 11, I think, in Sydney and Melbourne. I don't know what the time is in Adelaide and Perth, but we'll end off right there. Thank you so much for joining us today and your patience, and those of you who put questions through, thank you very much for putting questions through. The best way is to probably just email me any questions. I'll send you contact details and we'll go from there. Take care, and we'll see you at our next event.